Good morning, everyone. First of all, I would like to thank the organizing committee for giving me this opportunity. So, I will be presenting the abstract on final OS result and subgroup analysis of savolitinib in patients with MET exon 14 skipping mutation non-small cell lung carcinoma. It was originally presented in the European Lung Cancer Congress. So, as we all know, MET is a proto-oncogene and it is mesenchymal epithelial transition factor. It is mapped to the 7q31 locus of chromosome 7. It encodes for receptor tyrosine kinase for hepatocyte growth factor, also known as scatter factor, and MET dysregulation were initially recognized as one of the secondary mechanisms of resistance to EGFR TKIs. Subsequently, MET exon 14 skipping mutation has been reported in 3 to 4% of all non-small cell lung carcinoma cases, and the prevalence being highest in the sarcomatoid carcinoma, 4.9% to 31%, subsequently followed by adenosquamous carcinoma, then adenocarcinoma, and lowest in the squamous carcinoma, squamous histology with 2% of cases. So, savolitinib is a highly selective MET tyrosine kinase inhibitor. It has been used in various malignancies including gastric and papillary renal cell carcinoma and non-small cell carcinoma. So, prior studies like the TETON study, it was a phase 1B study which included advanced EGFR mutant non-small cell carcinoma with MET amplification, and the overall response rate was 44% in the 18 patients who have received the combination of savolitinib with osimertinib. Other trials which are evaluating the same regimen are the Savannah and the Orchard. So, initial phase 2 study result was presented in 2020 ASCO, and at the time, as of 31st October 2019, 593 patients were pre-screened or screened, and 87 were identified to be MET exon 14 positive, and 70 were treated. So, at that time, overall response rate was 47.5%, disease control rate was 93.4%, and the median duration of response was not reached. The median PFS was 6.8 months among all treated patients. Most common treatment-related adverse events were peripheral edema, nausea, increased ALT/AST, vomiting, and hypoalbuminemia. The incidence of more than or equal to grade 3 adverse events were 41.4%, and treatment-related adverse events leading to treatment discontinuation occurred in 14.3% of patients, among which liver injury and hypersensitivity were the most common. So, with this background, as the previous data showed a clinically meaningful overall response rate and manageable toxicity profile in patients with MET exon 14 mutated pulmonary sarcomatoid adenocarcinoma and other non-small cell carcinoma. So, savolitinib was approved in China for the treatment of patients with MET exon 14 positive non-small cell lung carcinoma. And here in this study, the authors reported the final overall survival result and the subgroup analysis of the phase 2 study. So, coming to the study design, they selected unresectable metastatic primary sarcomatoid carcinoma or other non-small cell lung carcinoma who were MET exon 14 positive and failed or medically unfit for chemotherapy or naive to MET inhibitors. So, savolitinib was given in weight-based dosing of 600 milligram or 400 milligram orally once daily for 21 days cycle, and the treatment was continued till disease progression or unacceptable toxicity. So, the primary endpoint was overall objective response rate, and the secondary endpoints were disease control rate, duration of response, PFS, 6-month PFS rate, OS, and time to remission. So, safety and tolerability. At the time of data cutoff of final analysis, which was June 28, 2021, so 14 patients, that is 20% of patients had received more than 18 months of treatment, and median follow-up was 28.4 months. So, in the baseline or for demographic characteristic, so they divided the patient cohorts into 4 categories. There is full analysis subset according to the primary tumor type, prior anti-tumor treatment, and brain metastasis status. So, in the full analysis set, the median age of the population were 68.7 months. Among that type of primary tumors, 25 patients had primary sarcomatoid carcinoma, 45 patients had other histologies of non-small cell lung carcinoma, almost around 28 patients were treatment naive and 15 patients had brain metastasis. So points to, and most of the patients in the full subset had ECOG performance status 1. So points to be noted in the treatment naive population is that their median age was 74.5 months, and they also included a more higher number of primary sarcomatoid carcinoma, that was 46%. So the PFS result in the full analysis subset and the subgroups as assessed by the investigators, they showed a median PFS of 6.9 months, and as in the prior treatment or treatment naive subgroup, those who it was 6.9 months in both the subgroups, and in PSC versus other non-small cell lung carcinoma, it was 7 months versus 5.5 months. And those with brain mets versus without brain mets, it was 7 months versus 6.2 months. And if we look at the OS result, the median overall survival was 12.5 months. And in the treatment naive subset, it was 10.9 months versus 19.4 months. But there is a small caveat that most the patients in the treatment naive subset were elderly, and there were more number of primary sarcomatoid carcinomas. Similarly, if we see the subset analysis in the primary sarcomatoid carcinoma and versus non-small cell lung carcinoma, it was 10.6 months versus 17.3 months, and those with brain metastasis had 17.7 months versus without brain metastasis, it was 10.9 months. So, and coming to the safety analysis, so the most common treatment-related adverse events were peripheral edema, nausea, hypoalbuminemia, and with prolonged follow-up and exposure, the incidence of adverse events was similar to previously reported data. So, the updated results further confirm the favorable benefit of savolitinib in patients with MET exon 14 non-small cell lung carcinoma, and in each subgroup, and with the acceptable safety profile. So with this, we have a burning question, that is Messi can be the new Ronaldo, and for that we have to see the finals. Thank you.